My name's Jacob, and I'm going to be reading out the World Medical Association Declaration of Geneva today. But before we get to that, I've been invited to say a few words about my time at the Hull York Medical School. I'd like to start by saying, as everyone else has today, hello and thank you to everyone who is joining us today. Although we're not able to celebrate together in person, I take it as a mark of our community's resilience that we're still all here despite the lockdown and making the most of the options available to us. This sense of community resilience comes as no surprise to me, as when I look back on my time at the Hull York Medical School, it's the feeling of community that stands out. It's one of the things that made it my first choice of medical school when I applied, and something which has made my time at the school very precious. From my very first day, I felt welcomed into the community by everyone I've met, and I've been made to feel at home. I'm sure you will all remember, as well as I do, the feeling of trepidation and excitement before attending your first ever problem-based learning session, and the sense of eagerness and intrigue to learn more about medicine. However, looking back, it's not the material that I remember most, but the people. I remember how welcoming and supportive my first and second year PBL tutors, Dr. Bill Laffey and Dr. Marie Cohen, were, and the perspectives, experiences and insights that each of my colleagues brought to the groups. I remember my first ever anatomy lecture delivered by Professor Bazira, which sparked in me an interest that would 3 years later lead me to pursue a master's degree in clinical anatomy and education. And I remember the many people, from academics and doctors to the brilliant SLO and student support teams, who have inspired me and kept me going along the way. As we have progressed through the medical school, I'm sure that each one of us will have our own list of people who have motivated us and inspired us. Each of us will have our own story of our time here, our own friendship groups, our own memories, but all united by our shared experiences as part of the Hull York Medical School community. And at a time like this of global crisis, I think it really becomes apparent how much communities matter. All across the world, people are scared, families are being separated, and it is to us as healthcare professionals that they look for help. It is easy to forget how frightening and overwhelming an environment such as a healthcare setting can be when you're not used to them. And as newly graduated doctors, we will remember this better than any. One experience in particular that stands out for me was during my first day in hospital as a third-year medical student, when I was on the acute medical unit and asked to bleep someone. I didn't know at this point in time what a bleep was or how to do it, and I felt completely overwhelmed by the hectic environment with strange noises, bleeps and smells that was completely unnatural to me. A few days later, when I returned to the very same ward, I was surprised by what a different experience I had. And I have to say that was almost entirely due to the friendliness and kindness shown to me by one nurse who noticed my hesitancy and made me feel welcome. So when moving on to wherever you're going next, think back to those people who helped you at your most challenging times, the people who helped you when you were feeling lost or overwhelmed. Because wherever we move, we will be doctors. People will look to us for support and guidance, and it will be up to us to help to foster the same sense of community that we found here. And with that, I'd like to say thank you to you all for bearing with me during this speech. I would also like to end by saying a personal thank you to my own parents and wider family for supporting me both personally and financially during my time at university, as none of my achievements would have been possible without their help and support. I would also like to say a massive thank you to everyone at the Hull York Medical School who's helped to make my time there so memorable. Okay, so I'm now going to move on to read out the Declaration of Geneva, and I invite all graduates watching today to join me. And please repeat each statement I say after me. As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease, disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me, even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good medical practice. I will foster the honour and noble traditions of the medical profession. I will give to my teachers, colleagues and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honour. And with that, I'd like to say thank you very much for bearing with me. I'll now hand you back to our Dean, Professor Una MacLeod.